Well, we've got an update from Allen County Public Health. We've got the commissioner with us, Brandon Fisher, and thanks for coming.
Well, thanks for having me.
All right, first of all, let's start out. The CDC, they just made some new recommendations for respiratory. Is that what it is? Tell us.
Yeah, so it's changed to respiratory virus recommendations. So that's previously we had COVID as 5-day isolation. If you get COVID, stay home for 5 days. That's all gone. So just treat it like you have flu. If you have a fever, stay home. If you don't feel well, stay home. But once that fever's gone without medication like ibuprofen or acetaminophen to bump that fever down for 24 hours, and you're starting to feel better, you can get back to work. They recommend, washing your hands. If you feel up to it, wear a mask. Just kind of keep your distance from people for about 5 days after. But with people having exposure to COVID over the past 4 years and vaccines and everything else, unless people testing and having the opportunity to test, it mimics a lot of other stuff that we have going around. So just treat it like what we have. Understand that there's a potential risk, so do what you can to prevent the spread as much as you can when you get back. But they're trying to make sure that you can get back to normal activity, but just stay home when you don't feel well, and ahead of time get vaccinated, whether it's for flu, COVID, if you're eligible, RSV, and just take care of yourself.
Right, yeah. It's kind of like the same with many other things. I mean, if you have a temperature and don't feel good, stay home, right? I mean, that's kind of the basics.
And that's the biggest thing. Like, you're not going to be productive in the office if you don't feel good. If you got 101 fever, there's no point in going in. There's no point in going in and making anyone else feel sick. So stay home, rest, be in bed, watch TV, do whatever. Get yourself better, sleep. And then when you're feeling better, you can get back and catch up on what you're doing and get back to work.
All right. Okay, so the countdown is on. I mean, the total solar eclipse is coming. And you do have some safety tips, especially from the health department, right?
Yeah, so the biggest thing that we got is we want people to enjoy the event as best as possible. So we know that people want to take advantage of the event, get out, sell the food that they have in the community. We got a lot of events with food trucks in the community. A lot of these vendors that we have in the community, they do an excellent job of providing food. But we got some people who, they might pull up a trailer and it looks a little suspicious. Big thing that we tell people when they're going to a food truck, just look for the license. Make sure that that food that there's being prepared is safe. When they're licensed, we have them go through different classes. They're required to go through different classes to make sure that they're preparing that food and storing it at the right temperature. And the big thing with that is you want to enjoy the event, but you also don't want to have bad food that you feel the effects of afterwards. So we get people who report to us that they don't feel well. They go to a restaurant, they feel like they have issues, stomach issues, feel like vomiting, diarrhea after the fact. We have staff that they go out, we work with the restaurants to try to figure out what's going on. Sometimes it's people who sell their stuff on Facebook, and we can't kind of find those people because they go by pseudonyms. So it's tough to catch those people, but when you look for a license, we know that those people have gone through extensive testing and are able to prepare that food. So the biggest thing is just look for that license when you're out and about, and make sure you're protecting yourself. So once you get done with the event, you can enjoy it and you can be on with your life and protect yourself.
Are they required to post it? I mean, should you be able to see it in a food truck or whatever, a stand or whatever?
It should be able to be there, but if it's not clearly visible, you can just say, hey, you guys have your license. And it doesn't have to, in Ohio, it does not have to say it's from Allen County Public Health.
Oh, okay.
It'll basically, if we issued a license, they can go all the way up to Cleveland and prepare food up there and go across the state. So as long as it has an Ohio license with an expiration date of 2025 at this point, they can prepare food and do whatever they want. So yeah, we work with basically 110 other health departments across the state and do the same thing, same standards to make sure everyone's doing things safely.
That was a very good tip for the eclipse, because we're going to want to eat and party while we do this.
Yes.
Thank you very much for coming today.
Well, thank you for having me.
All right, don't go away. New Edition continues in a moment.